patients who've had melanoma, if there was a piece of advice that I could give them, it really would be to have their skin looked at by a dermatologist. And the reason I say that is because I do see a number of patients who have had melanoma, and that only comes out when I'm asking them questions about other things. And when I push further about asking them about their melanoma, often they have seen, let's say, a surgeon who will cut out the melanoma, which is certainly the right thing to do. But the most common thing for people to develop after, let's say, a melanoma, instead of a melanoma at that spot, or a recurrence, what we call a recurrence, would be to develop a new lesion that might be of concern. And so that's why it's important for a dermatologist to see the patients who've had melanoma, because we want to look everywhere on the skin and look for another lesion before it becomes a melanoma. So that would be the one piece of advice I would give patients who've had melanoma. Obviously, sun protecting your skin and doing your own skin checks following the ABCDEs of melanoma detection, but also is to see a dermatologist, especially early on in those first, let's say, couple years after having a melanoma. I would want to have every patient who's been diagnosed be seen by a dermatologist.